Hello and welcome to the second edition to Nurse Anesthesia Education Exchange. My name is Dr. Stephanie Woodruff, and I am with my counterpart, Dr. Crystal Honeycutt. Hi, Crystal. How you doing?
Doing great. As Stephanie so lovely introduced me, I am Crystal Honeycutt. I don't work for SNAP, but Stephanie and I are longtime friends. I work for Virginia Commonwealth University.
And I obviously work for SNAP. So without further ado, I'd like to introduce one of our integral part of our teams, Dr. Sarah Connor. She also works for SNAP. She's one of our newest faculty members. And of course, everybody knows Dr. Richard Wilson, my assistant director on the East Coast. Thank you both for joining us. So today we are going to talk about decoding the self-evaluation exam and the national certification exam because for students and for faculty, it can be a little confusing. And so right off the bat, Sarah, we're going to ask you some questions. Crystal, you want to go for it?
Sure. I'll get started. We'll kind of bounce off one another. And when we are asking you questions, if you think of something else we need to know, please let us know, Sarah. That would be great. But we'll start for our listeners since they may be curious, they may not know. Can you tell us what is the C? What is the C designed to measure? And let our new faculty as well as our residents kind of know what to expect.
Perfect. So the C exam is a test that many programs use to sort of evaluate board readiness for their residents. Some programs implement it a minimum of 2 times. Some programs implement it once. Students have 4 hours to take 240 questions. It is computer adaptive, but unlike the NCE, it is 240 questions regardless of your performance. There are 4 domains. There is basic sciences, there is equipment, there is general principles, and then special populations / surgical procedures. And each of those are weighted 25%. What that really does is give us and students sort of a benchmark to evaluate how things are taught in the program, if things are appropriately placed, how they have retained information throughout their didactic period, and gives us a starting point to sort of prep them for the NCE exam.
Excellent. And if I'll go and kind of build on that a little bit more, and then I'll let Dr. Woodruff kind of jump in as well. I don't want to feel like I'm hogging the podcast. But, where students are using these, and we said that you mentioned an important part is that programs are using them to make sure the curriculum lines up appropriately. What would you say to a student? Do you feel like these are more of a predictive of how they're going to do on boards? Should they be concerned, or is it more of a, or is it truly predictive of, how they're going to do? Like if they fail or don't meet the benchmark for the C, should they be concerned about passing their NCE?
I have seen in my experience students that have not met their programmatic benchmark and gone on to pass the NCE. And there's a couple of reasons for that. Number one, like I said, it is a tool for us to help assess readiness. So in the time that they take the C exam to the time that they are released to sit for the NCE, a faculty is able to work with students individually to boost their areas of weakness. Additionally, the NBCRNA has not designed the two to coincide. It is a better predictor. The C is a better predictor now than it used to be. However, there really isn't a score per se that guarantees that you're going to pass the NCE, because there's multiple factors that go into that also. You could be having a bad day. The environment, it might be too cold or too loud. You can't concentrate. You might have scheduled it around getting a job, and so there's a lot of pressure. So there's multiple factors that go into your performance on test day for the NCE. The NBCRNA does publish results of first time pass rates and the correlation, as loosely as it is, to the C exam scores. And it seems like people sit around a 430-ish, go on to successfully pass the NCE the first time. However, like I said, additionally, part of the reason why there isn't a strong correlation, or you can't definitively say that how you do on the C is going to predict how you're going to do on the NCE, also is that they're two different exams. So like I said, the C is 4 hours, 240 questions, computer adaptive. The NCE is anywhere from 100 to 170 questions. Computer adaptive, you have 3 hours, and all of the domains are weighted differently. So where each category is 25% on the C, they range anywhere from 25 to 35% on the NCE.
So Sarah, on a more personal note, why do you think they make these exams intentionally uncomfortable for the students?
Well, I mean, there's a lot of thought processes about that, right? The operating room is uncomfortable. It is a precursor to what we are going to be doing as a career, right? Thinking well under pressure, navigating high stress environments. The purpose of the NCE really is to see, are you minimally competent to sit in the operating room? And so we would be doing students a disservice, I think, if we made it comfortable.
Yep, it's cold. You can't bring your support water bottle. You have to take off your hat and your watch. You don't have your little comfy chair that you're used to sitting in. So it is, and it's really long. I mean, 240
Right.
questions, you definitely have test fatigue, and test fatigue is real for sure.
Yes.
So Richard, can you tell us a little about of understanding the C report, because it can be a little hard to navigate for newer faculty members.
Oh, yeah. So thanks for that question because I really love looking at kind of the data points and the statistics. And we got to remember that really when you're looking at the C, and we'll focus on it right now, is this is just another data point within the program to determine whether your cohorts, your individuals, your residents are ready to take the national certification exam. So when you're really looking at it, you got to understand what it's all about. Sometimes we get focused, and as Dr. Connor was mentioning, you've got the number, the correlation that you have in the 430 and how it correlates to usually a successful first-time board pass rate. But we got to remember all of that is also retrospective data. So that's correlation, not causation, right? So it's just retrospective data telling us where things look like they correlate with each other. But when we look at the reports in itself, it would be easy to get focused on that 430 and to look at that 430 and say, hey, Richard scored a 430 on this. He should be okay to pass on the first attempt, or he got a 415, maybe borderline, if you start looking at that. But what we really have to look at is also what is the breakdown of it. So as we're talking about those 4 domains and we start looking at it, and now we start looking at the fact that some are 20% on the NCE, but they're 25% on the C exam and how they're tested, right? Some are 25% on the C exam, but they're 35% on the NCE, counting towards the overall score that you get. You need to be able to look at those because then we can also analyze, okay, where are they doing well and where they're not doing well in. The reason for that is it helps with preparation moving forward. In other words, you can score really high on maybe domain 1, and domain 1 is basic sciences, right? But you have scored really poor on domain 2, which you're talking about equipment, instrument, and technology. Well, it's easy to say, okay, well, you scored well in this one, let's keep working on that, but forget about domain 2. And what we've got to do is when you start looking at these benchmarks and you start looking at these scores and the breakdown of the scores, again, not just overall the 430 or the overall total score, but in each individual characteristic or each individual domain, then we can start seeing, okay, where does Richard need to prepare more? Because the risk of this is getting comfortable that he scored well in domain 1 and then not really focusing on domain 1 much, but focusing heavy on domain 2, 3, or 4 because he struggled in those. And then if he doesn't pull those up very much and domain 1 drops because you didn't do anything in it, then you've got a risk of not passing the NCE or reaching those benchmarks in future C exams. So really understanding that, and then it gets so detailed, right? Because even taking domain 1, then you can dive into, okay, well, If you didn't do well in domain one, what does domain one cover? So now we go into the C and the NCE content outlines that are located on the NBCRNA's website. And then you can start diving in those and go, okay, what inside of that? So what we really like to do, and one thing that we have been working on within our program, Dr. Connor and I are working heavily, of course, with the C and the NCE preparation, is having the students self-identify within those areas. Okay, well, you didn't do well in domain one. Go back and look at domain one, and I want you to self-identify where you did not do well or what concepts in that domain do you feel like you need the most work on, and what do you feel like you need the least work on, and so we can compare all of that. So there's a lot of data just in those, you know, four little scores that we think about in the domains. There's a lot of data we can pull in from there to be able to recognize it and figure out, okay, where do we need to guide, prepare, and help the students to make sure that they're reaching their ultimate potential.
So what you're saying is students who score, let's just say a 410, have two different study plans. Is that what you're saying?
Oh, absolutely. I mean, and here's the reason why. I mean, let's just go to a couple of different scenarios and I'll quickly go into them. Say you've got, student A and student B both score 410, and you are talking to them and you find out that, okay, well, student B comes in with a 410, but they're like, oh, well, I was able to narrow a bunch of information down and I was able to guess on a lot of these questions, but I scored a 410. Well, I mean, that's a risk, right? Because if they guessed A and got them all right, but next time they guess B and they get them all wrong, I mean, we're looking at a 375 potentially instead of a 410 per se. So that's, we've got to really now start studying, focusing on them of what's your test taking strategies? How are you eliminating this information? What are you doing when you read the question? What are you doing when you walk into the exam, right? But then you got somebody else that scores a 410 and they just really, there was one specific area that they scored maybe, and I'm going to make up some numbers here, obviously, but maybe they scored a 350 in domain three, general principles of anesthesia. Well, then that means we really need to heavily hit the information and not work on necessarily test taking strategies. But now we really got to work on, okay, let's get the solid information on general principles of anesthesia down so that you understand the concepts to be able to go in to take the exam overall. So it should be tailored. It should really be looking at, again, their domain scores, looking at their performance in the classrooms and so forth, self-analysis. All of this comes into the fact of how do we really get a tailored plan, because the way I study and the way Dr. Connor studies, because she's just slightly a little bit younger than me, may be completely different, right? And the way we process information may be completely different. So we start talking about study plans, they really need to be very focused on the individual, their needs, their study plans and tactics, their strategies, so many things that go into it. And then you can even get into the fact that as they're preparing for these, they're all in different clinical rotations in different clinical settings, which have different needs and different requirements. So all of that goes into the individualized plans.
Thank you, Richard. Crystal?
Sure. Richard, I'm going to kind of tag team a little bit off of what you were talking about. And you were, talking about the students using it as preparatory to study and strengthen their score, which I completely agree with. I think it's a great idea. But for some of our residents out there and our new faculty, sometimes when students are studying and it's fear-based studying, they can actually perform, inadequately compared to what they would do if they weren't afraid. So could you explain a little bit to our listeners, how does fear-based studying sabotage performance? And is there anything we can do about that?
Oh, absolutely. There's a lot that we can do about that. And we have to really have a whole different podcast, right, on generational differences. We could do that in a whole different setting, which goes into talking about this preparatory side of this, right, and fear-based learning. We also need to remember that there are studies out there that show actually stress increases knowledge base. So when we're stressed, and that's what we're doing in these operating rooms, right? Our individuals are getting stressed. It's their first intubation. It's their first art line. It's their first aortic dissection. these are stressful situations, and they walk outside of it with more knowledge than they had when they walked in. So we've got to really focus on that fact of it's not necessarily what's going on in the moment, but what happens afterwards. So how do we go back and we reassess what happened in that aortic dissection? And then be able to say, okay, what did I learn from that? Well, that's what we got to be doing in our fear-based or our stress-based learning models that we as faculty are leading the students in. So it's not just necessarily, and it's been proven in simulation. I know both of you are very, very skilled at simulation and do a lot with it, but it's all about the debriefing, right? It's a lot about the debriefing, what happens after the scenario of where they learn from. So we need to make sure we're creating models that, yes, there's got to be low and high stakes testing that's involved in all of this. And that low stakes testing and that high stakes testing is creating anxiety and sometimes fear of failure. And we've got to understand that fear is the fear of failure. So we've really got to start teaching our residents, and we've got to really start promoting, you know, it's okay to fail sometimes. It's okay to not get 100 on this exam. It's okay not to get a 95 on this exam.
And that is
But
hard
what
for
have
them.
we?
That
It
is
is
very
very
difficult.
difficult. It is very difficult because they've
They're
been
not used
taught,
to it.
right, and they've been taught you're the best, you've got to be the best, and that's the only thing that's going to survive. But we really got to focus on, okay, what did you learn from this? And so that always comes back to debriefing, that always comes back to reflections. So at the end of the day, when I do a lot of mentoring and guiding on this, I always want to come back to them at the end of the day and go, what did you learn from this? Where are you now compared to where you were 8 hours ago, a week ago studying this material? Because that builds confidence once they're able to look back and look over a period of time instead of looking back over the last 30 minutes or an hour of what they've been doing.
Right. So, Sarah, what if I do poorly in, let's just say, domain one? How do I prioritize my studying to increase the value or my scores in domain one? How do I do that? How long does it take to correct my poor performance in domain one? And what would you say as a faculty member? What would you tell me as a student?
Well, first of all, that's kind of a loaded question. How long it takes to correct your deficit depends on a multitude of factors, right? Um, like Dr. Wilson pointed out, your clinical schedule, how much time you have to devote to studying, what the deficit was, because there's a difference in a study plan between someone that scored a 400 in a domain and someone that scored a 350 in the same domain. I think in terms of anesthesia school studying and then studying for the NCE and the C, this is different than anything we have ever done before. And so you guys talked about high achievers a second ago and how difficult it can be to not equate your value with the number on the exam. My Again, I'm newer out of school, and so I identify the frustration of where you feel like you've studied for 8 hours or 12 hours and it doesn't translate into a score. I think that we have to, and Dr. Wilson and I are working on this with our residents currently, shifting the way that they are studying. I would rather have you spend 1 hour or 30 minutes of good, dedicated, my phone is off, I'm not distracted, I'm not at home with my family, studying than spending 12 hours on a weekend where you're getting up constantly, stopping to vacuum, your kids are interrupting you, you're doom scrolling on TikTok. So, kind of shifting the way that they study and solidifying the fact that, another thing that you guys mentioned was people who meet the benchmark. Honestly, those people, depending on how far out the C exam is from the NCE, concern me a little bit more than the people that didn't meet the benchmark. And the reason is I worry about them getting too comfortable and not continuing to review old information and just thinking, oh, okay, I got it. I scored above the benchmark in all of these domains. I'll be fine. So I think trying to get students to understand the value of constantly going back and reviewing old information and switching their study habits from passive learning to active learning. All of these things help contribute to a successful rescore in that domain,
What
but
do you
it's
mean by
very
that?
individual.
Passive versus active.
Just Another thing that I think that students do is they look at the volume of questions that they're taking and think that a large volume equates to quality studying. And that is not true either. Teach back methods, the cover up test, making mind maps, all of those are things that most of us have not done prior to this point. But studies have shown the value of those methods in medical education and really contributing to long time overall learning. For better or worse, the NCE, is our barrier of entry to practice. But I like to, one of my favorite quotes is, you're not studying to pass an exam, you're studying for the day when you are the only thing standing between the patient and the grave. And so, getting students to move from memorizing to pass an exam in didactic to really understanding foundational concepts means that no matter how the question is asked to you, you will understand the information and be able to answer it.
So something, if I don't mind, I want to jump in here, as Dr. Connor mentioned, and two unbelievable thoughts in here that really, I think, should resonate with all faculty. And hopefully we can get this to resonate with the residents is, quantity over quality is what a lot of people are considering, but it really needs to be the reverse. It needs to be quality over quantity, right? We need to make sure that we're studying or they're studying or we're teaching the material in a method that provides a high quality product versus just worrying about how much has gotten studied. And I will tell you that from experience because I've obviously over my 15 years, I've done a lot of coaching on study strategies. And as I talk to learners that are struggling, what I hear a lot is, oh, I just need to put more time into it. I'm like, wait a minute, no, stop right there, because you can put more time into this, but if it's ineffective, then you're actually creating a bigger void here, a bigger gap than you had before. So I really think that, one thing to think about, and then the active versus passive. And look, I love podcasts. Obviously, I'm sitting here on one, so I love podcasts and I love doing podcasts. But we also have to remember podcasts are passive techniques in learning. They're just listening techniques. They're great. They have a great place for learning, especially in concepts that are new that we may not understand well or in a different format than just looking at a PowerPoint. But we've got to be able to also regurgitate that back out. We've got to be able to explain that. We've got to do these mind maps that she talked about. That's the active part. So we've got to be able to balance both of those, and our learners have to be able to balance those two in active and passive. But unfortunately, with podcasts, with PowerPoints, with recordings, with technology today, a lot has gotten pushed towards the passive techniques, and some of the active techniques have gotten overlooked.
Mm-hmm.
I think that's a great comment to kind of focus on that active learning to help with the retention. Sarah, something you mentioned earlier I thought was great. You were talking about those who pass the C early. That's concerning, and from my standpoint, that is as well, because there can be, like you said, they can kind of get relaxed in that fact. Could you maybe explain to our listeners why we sometimes say, or faculty will sometimes say, that struggling on the C is actually a benefit and a good sign of being able to be ready for the NCE?
Right, exactly, because those are the students that are motivated to continue studying. There isn't a complacency there because they know that they can't afford that. Also, those tend to be the ones that faculty are more in constant communication with. So I feel like we have to do a good job also of not letting our stronger students slip through the cracks.
What do you tell a student saying, "Oh, I'm just a terrible test taker. I tense up with anxiety." What kind of advice would you say that to that student?
I did have a friend actually that took the NCE, the amount of times that you could take it before having to go back through school. She's a phenomenal CRNA. I let her take care of me when I had surgery. So that is true to some degree for some people. However, there are coaches that work specifically with testing anxiety situations to help you overcome that. She hired somebody on before her last attempt and credits that person with her being able to pass the NCE. It's obviously not a knowledge deficit there because she made it all the way through anesthesia school without issues. But the stakes are so high. You spend 3 years in school, you're accumulating this debt. Some people have families on top of that. Failure is not an option. And I think that every time you take the exam and don't pass it, it contributes to your negative mindset. But when you look at the NBCRNA and APEX and some of their test taking advice, one of the big things that they focus on is mindset. You have to be able to look at a question, know what you don't know, make an educated guess, and move on, and not let it mess up your mindset for the rest of the exam. And I think that programs play a role in that as well, in trying to simulate these environments for our students to the best of our ability as test taking time nears. It would be beneficial if we set up testing environments like that, where we had 240 questions and had them sit and see what that is like to help build up their testing stamina. If we simulate the anxiety of walking into like that, taking all of your stuff, let me have your hat, sort of like what I imagine maybe, I don't know, going to jail would be like a little bit. Trying to create that environment for students so that they have in a low stakes environment, in a school exam, the stress of what it is like to walk into the NCE or the C.
Thanks.
And I'm going to kind of follow up a little bit, and this can be for Richard or for Sarah. I think you both have unique perspectives, but what habits or what techniques can residents, do you see the difference between residents who improve, say I was a scorer and I didn't meet my benchmark, and I, worked on a plan, and I went back and I, improved drastically, versus a colleague who went back and just kind of remained, stationary. Can you talk a little bit about what you've seen in your experience of what are those two doing different, or, what would be the most beneficial?
Oh, I'll jump in here because I have a very strong opinion on that one, obviously.
No,
Oh,
no.
absolutely. But really, when you look at those two individuals, all right, you start talking about why does one excel, right? And why does one maybe stay the course overall? It really is about mindset and motivation. All right, mindset and motivation. And the mindset is, do I take a personal interest and a personal accountability for this? So, in other words, yes, I didn't do well necessarily, right? And I kind of struggled maybe and did borderline on this exam. But is that Dr. Connor's fault? Because Dr. Connor didn't give me the right plan. She didn't give me the right exam. She didn't give me the right information. She didn't teach me well, yada, yada, yada. And by the way, anybody listening to this, she's a fabulous instructor. So let's just leave that out there for right now.
Very lucky to have her.
But just say that she is my instructor, right? Do I say that she did that information? Is that really on her? Or do I come back to it and go, okay, where did I make the mistakes here? Where did I not focus? Where did I struggle on looking at my study strategies, my time management? So really looking at that, it comes down to the fact of, do I take personal accountability? Now, I may still depend on Dr. Connor for a lot of stuff, but have I taken personal accountability to say, okay, hey, Dr. Connor, here's what I need to help me get through this, or here's how I need you to help me, or here's how can you guide me through this information? Or do I just sit back and go, you know what, I'm just going to follow the plan that was given to me, and we're going to see how this works out. If that works out, great. Because a lot of the plans that we're going to design are really going to be what we feel like based on knowing somebody, how well they can work for them, but there's still got to be the motivation of that individual to get through that, right? It's got to be the personal accountability and the motivation. And the motivation is, what is the motivation? It's the motivation, family members. Is the motivation a better life than you've had before? Is it to get into that practice to be able to, practice to the ultimate scope that you can in the nursing profession? Is it, the fear of embarrassment? What is that motivation? And you've got to find that motivation within yourself. The faculty cannot find that motivation for you. You have to find that motivation within yourself that's going to drive you. And that's what you usually see is the difference.
And one thing that actually Dr. Wilson taught me that I love, that he does with our students, is when he gives them an exam, when we're using Apex or Prodigy or whatever we're using, he has a spreadsheet that he has them fill out. And there are 3 areas. Did you know this question? Do you know this information? Great. That's one step. That doesn't mean we forget about that, but we will review it. Did you guess on this question and just happen to get it right? That we also need to focus on, because that tells me that you don't actually understand or know that content, and that's important for us to sit there. Or did you just not know it at all? And so obviously, yes, we need to review that. So I think, like Dr. Wilson was talking about, putting the onus back on them and really having them evaluate where their deficits are. I can look at a bunch of numbers and reports that Apex runs for me, or that our testing system that we use in the program runs, but I don't know, unless you tell me or when I'm talking to you, how your mindset was during that test, how you felt about this information, and what it is that you think that you know. The people that don't know what they don't know, those are the ones that can cause a problem. So
Sarah, walk
Yeah.
me through the process. Oh, I'm sorry, Crystal.
Oh, that's
Walk,
okay.
walk me through the process if I just took the C for the first time, and I really just did not do well. I mean, I was pretty much on the bottom, lowest scores of the class. What would you say to me, and what is your interpretation of that?
So it's multifaceted, right? We obviously look at your overall score and we look at your domain scores. We're also trying to look back at how you've done during the program in exams. We ask, how did you feel about this exam? Did you think the information was straightforward? Did you feel like there were questions you didn't understand? Because from my perspective, when I took the NCE and the C, not being super far removed, I didn't feel like it was like the NCLEX at all. I didn't feel like they were trying to trick you. I didn't read the questions and say, what are they even asking here? It was like, I knew it or I did not know it. And that was that. Um, Trying to figure out their mindset for the exam. Was there anything going on? And then also really evaluating their preparation. Like we said, I have talked to students that didn't meet their program's benchmark, and they said, I don't understand. I did 2,000 questions. I think that people think that they will see questions and, okay, I know this. I've seen this question 30 times. I know how to answer this question. But if they don't really understand the foundational concept that's being tested, if you change one variable in that question that you're asking for, it's completely new information to them. So really getting down to the root of how they studied for that in order to make a plan for them going forward.
And I'm going to kind of jump off that and go from the other perspective. Say I'm, a new faculty member, and this is my first time evaluating C scores, and I have several students who didn't meet the benchmark. Maybe one of the scenario Stephanie just gave, that the students did not score well at all. How does the faculty, what would your advice on how to start the process of remediation for this student? I know you mentioned some things you do, but just if you're speaking directly to the faculty, what would you advise, Sarah? And then Richard, obviously jump in as well.
I would advise, all of those things, talking to the student first and foremost, to see about their study plan, see what they thought about the exam, because you have to evaluate, is this a knowledge deficit? Did they just have a lot of anxiety because it was the first time they took it and they messed up? That's why we look at their performance in the program as well, and find out how they studied for this information. You have to sort of take a 360 view and look at the score as it is on paper at face value, but sort of interpret all of the things that went into them scoring that on that day.
And a couple of things I recommend is one, I've always recommended, all right, 24, 48 hour break. So when a student has messaged us, right, and it's talked about, hey, I did not meet the benchmark, and this is, looking at, again, I've been on this for a number of years, it's usually like, okay, thanks for letting me know. Let's meet next week and let's talk about this. Because In that first 24 hours, we all have emotional responses. So we get into the emotional response of, hey, I'm so mad I didn't do well on this. And it's unfortunately, or fortunately or unfortunately, however you want to look at it, uh, our mind can't process everything at that point in time, those first 24 hours, other than that emotional response. If you start waiting 48 hours and so forth, now I can look back on the exam and go, okay, yeah, I did go into that exam stressed. Me and my bestie were fighting the day before, right? Or I had this issue that occurred, or I didn't get sleep that night, or we can always look back and figure something out, or I was unprepared in these areas. So that's why I usually recommend, hey, take that 48 hours, just kind of chill for a little bit. Don't worry about diving into new material. Don't worry about studying. You really need to process this, and let's talk about what was going on. Then doing some of that 360 view that she talked about, is you really look at a lot of evaluations. Anytime we're evaluating anything, there ought to be done, a 360 view should be done, right? And it's coming from multiple perspectives. And when we talk about that, it goes into exactly what she just mentioned. We talked about this before within our program, right? And we just did this with some students. And we found out if they didn't meet the benchmark that we initially set, we need to do a couple of different things. One, internally, is our benchmark where it needs to be, or does it need to be something a little bit different, right? As we look at our programs and as where they're taking the C in relationship to when they're graduating, going to take the NCE, there's multivariables that go in there. We also need to look at the fact of, hey, are we honest with them? That is one of the most difficult things to do, especially as a new faculty member. And I respect that because I was there. It may have been a long time ago, but I remember being there as a new faculty member where you're really maybe not far from age from some of these individuals, or you're kind of inexperienced in this and you're getting your feet wet and you want to make sure you're developing very positive relationships and being able to mentor and guide these learners. But there needs to be that honest evaluation too, which I have learned over the years how to do the kindness with truth method, where I'm still supporting them, but I'm also giving them the truth. You're more focused on social media. You're more focused on your clinical aspects. You're more focused on doing this than you are in preparing for this exam. And what we need to do is bring all of that together. So that kindness and truth and that honesty goes a long way. And I have found over the years, a lot of our learners really do appreciate it. And I'm going to tell you, a student of mine in the past is the one who actually taught me that, is they really want to, with kindness, right? With respect, but still be told the honest truth so that they know where to prepare and where to go from there. We just keep building them up, then we sometimes ourselves give them a false sense of security as they are approaching these next levels.
And Dr. Wilson touched on something really important that I think programs don't necessarily do a good job of doing. And that is that we can't lay the results of the exam completely at the feet of the students. Um, I really feel that the C, especially the first time, should be evaluation of the program itself. There are some programs that I talk to where their benchmark, to me, seems inappropriate for where their students are, and I would implore them to ask, what is your goal with setting that benchmark? Another thing is that programs set a benchmark for an overall score, but nobody sets domain benchmarks that they want students to reach. And so I think we really need to we know for a fact that the two do not 100% correlate. And I think that faculty sometimes lose sight of that. And so we really need to ask ourselves what the purpose of the C is and what we are using it for. And then when we have students that maybe don't meet the benchmark that we set, what does that really mean for us? And what are we going to do with that information?
So if I do well in all the domains, am I going to pass the boards?
We cannot 100% definitively say that.
So what does a long-term board success look like? I mean, I certainly have my own opinions on this, but what does that look like for that? What does that require for the students?
Constant review, constant sitting in the information.
And how many times do you think they should go over the information, all of the information prior to taking the boards?
Until you know it,
Where's the sweet spot? Okay.
until you can explain it to somebody. You don't truly
Yes.
know the information until you can explain it to somebody else. And if you're
Teach
not at that
practice is
point,
important. Mhm.
you know, I don't get so caught up in the numbers where I'm like, oh, you got a 450 on the C, you're going to pass the NCE, because you might have gotten lucky. We've already talked about the fact that people can be good guessers and things like that. If you cannot explain the information, in my opinion, you're not ready.
And I would add into that, and I know we're going to be finishing here soon, so I really want to get this all in there, is I'd implore all the residents listening to this and even faculty to think that C preparation and that NCE preparation starts from day one of the anesthesia courses. Sometimes we get caught up and think, oh, we're now through the anesthesia courses. Now we're going to start preparing for the C. If you're doing that, you're severely behind in the process. That starts from day one. So that comes from the fact of how are we teaching it in the classroom? How are we testing them in the classroom? And are we encouraging and promoting these individuals to take the information in, regurgitate it back out for an exam, push that information out the back of their head so they can start studying for the next exam to do that same repeat process? And if we're doing that, then what we're finding out is we're finding out that by the time they get to the major exams, these standardized exams like the C and the NCE, that they're having to relearn the information because all they have done is regurgitate and spit it back out, regurgitate, spit it back out. Even those that are very good practitioners in the clinical setting in their residency programs, because what they're doing is they're just mimicking the people that they're following and that they're practicing with. So they're doing a good job of that, but understanding it for the exam. And as Dr. Connor mentioned, whether, you know, I know there are different thoughts about the NCE and it being an entry to practice, but guess what? It is. You have to pass it. No questions asked. So that's why they have to be prepared for it also. And can't just say, well, Sue was a great, great practitioner in the clinical setting. Well, Sue couldn't do the second part, which was pass that NCE. That starts in day one. If we are encouraging them, reviewing this information and creating steps and processes and encouraging them to do the same information and challenging them to do the same thing and continuing in that studying and learning the information so they can do both what y'all just talked about, explaining it back, talking it back, teaching it to others, then we're going to see long-term success.
It's not just learning for the exam question, it's learning the concept, right? So we're going to wrap up here, but I do have like a little bit of a game to play. Rapid fire
I'm
is my
sorry,
favorite.
I'm having a bad connection here. I think that's for Dr. Cotter, and I'm out.
Rapid fire. Dr. Connor, you go first. What have you done right before an exam? Give me the top 3 things.
Gosh, pray, cry, eat a snack. Eating a snack is always very important.
Okay. All right. How about you, Dr. Wilson?
So before exams, I did not pull out a textbook and look at
We just
any
had this
information the
conversation.
morning of. I made sure I had my coffee and I just relaxed.
Okay. How about you, Crystal?
I guess my thing is the same. Don't pull out a textbook, and whatever you do, don't talk to your friends in the class because you will be so confused. Something you knew will go out of your head, and then you'll go down this downward spiral. So, and a
That's
snack.
such a good
Snack's good.
point. Oh my gosh, that's a
Yeah,
good point.
I said
yeah.
it's a downward spiral because if I think I
Get
know something and then I
anxious.
go, yeah, and I talk to Richard, Richard's telling me how he knows this, or Sarah says how she knows it, then I'm like, well, maybe I don't know it, and now I don't have time to study it. So stay away from others.
Yes. My rule of thumb, since everyone's asking, my rule of thumb is an hour before the exam, don't study, don't talk to anybody, and just think positive thoughts of gratitude. I know eyes are rolling. Positive thoughts of gratitude that you are going to do well on this exam. just eliminate all those negative thoughts, because those negative thoughts just creep into your brain and just cause undue anxiety when you essentially you know the stuff and you will do well, but you do have to have a positive attitude about it.
I'm surprised you
So
didn't
I
say
have
go for a run.
so I have a
That's
phrase that
afterwards.
you're talking about. Yeah, so as you're talking about that, I actually have a phrase that I have sent all of our students for several years, right before an exam, and I know that you, Dr. Woodruff, you know exactly what I'm about to say. Um, but I tell them if they really have been effectively studying, trust your knowledge and trust your preparation, because too many times we get into our own mindsets. And so I always tell them, trust your knowledge, trust your preparation, and this is going to be good.
Get out of your own way. Get
Absolutely.
out of your own way. Thank you so much, Dr. Sarah Connor and Dr. Richard Wilson, in our second edition of Nurse Anesthesia Educational Exchange. We really appreciate it, and have a great day, everybody.
Thank you.
Thanks for having us.
Thanks.